So can you give us a little bit of an idea on how long will it take for people to see the benefit from the Migra formulas in terms of their symptom relief and feeling their quality of life improve?
That's a really important consideration, Sumit, and probably the most common question I get from patients once we decide to use a nutritional approach. I typically tell my patients that if we're using a singular nutrient approach, such as a high dose riboflavin, the research shows that it takes about 3 to 4 months for noticeable benefits to really kick in and have the patient see benefit, which for many patients who've been suffering for a long time, it is a long time to wait. And I do try to educate them that it can take a while, that this is kind of slow medicine. But by trying to combine the therapies, especially putting in some of the high dose antioxidants, the coenzyme Q10, the alpha lipoic acid, that time frame typically is shortened. And I ask patients to give it about 6 to 8 weeks. But in many cases, we have seen improvement much faster. We actually have early studies with some of the patients to show that their blood levels, which were deficient in onset, go to normal within a month, as well as that improvement in levels also being associated with improvement in the migraine within a month. So we hope for that, but we try to educate, give it 6 to 8 weeks, hoping for better. We also know that some of the formulas, such as the Migra PM, with some of the ingredients like melatonin and more relaxing types of magnesium, are really key, because we know when patients that have migraine with a sleep dysfunction, there is strong research that if you really focus on improving sleep, that just 2 days of improved sleep has a significant impact in reducing migraine severity, just 2 days. So by trying to really focus on that in patients that have that issue, we know that you may get improvement much faster. And we have seen some case studies of that when we address the sleep issue while we're also addressing the bigger migraine issue. So I think that's a really key point to keep in mind.